Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. My assistant is Sheikh Mohammed Khan. And this is patient number 4 for today. A young gentleman, just 56 years old, with unruptured MCA aneurysm. Patient is hypertensive, came with headaches. On MR, on CT angiography, the anatomy was more ugly, and on these images it looked like a quite friendly aneurysm. It's the right side, and also Sheikh made a 3D angiography and found this working projection. Yes, now we are planning to do balloon assist coiling, and at the end of the procedure we will do stenting. First of all, assisted coiling and then stenting. Тағы да бір Y коннектор бере саласыз. И тағы бір трехходовой краник керек. Андай Y коннектор с хвостиком бітіп қалған ғой деймін, да? Okay. Sheikh took 8 French introducer sheaths, 7 French full key, angled one, and now we will take headway 17 with the Eclipse single lumen. Yes, bis cubic. Okay. Usually for this kind of aneurysm, I prefer to use 2 Y connectors. Тоже мынаның өзінікі бар ғой. We will use balloon for assistance. Язва баллиматорлар жоқ қой, да? Thank you, Maksat. Okay. We will take 60% of contrast. This is preparation of the single lumen balloon, like a hyperglide hyperform. Just a Y connector connected, and then we will take a for the Eclipse single lumen, there is a hybrid 1214 in the box. It's a set. It's coming as a set. That's why no problem. It works also with Traxxas 14. 14 is 1214. The difference, the flexible part of the hybrid is distal 30 centimeter, and in Traxxas the flexible part is 40 centimeter. That's why at my early experience I prefer to use Traxxas in combination with this Eclipse single lumen. Okay, now we locked the balloon, inflating. Yes, balloon is ready. Just pull the wire and balloon is deflated. It was J-curve, and after the placing inside the balloon, it's losing the shape. Huh? Okay. Okay. Because of the stenting, I will place the coiling catheters through the straight connector, and balloon I will send through the side one. Yes, I tried to apply for the Singapore visa. Unfortunately, I realized in the morning, as a Kazakhstan citizen, I need a visa to visit Singapore. No, it's not on arrival. It was in Thailand on arrival, but in Singapore. Okay, Sheikh Ahmed will explain me. Because I connected, I did a telephone call to the tour company, and they said me I need to organize the visa. It's a problem, huh? My flight was scheduled for the evening, but now my travel to the Singapore for the World AVM Congress under risk. Okay.
I'll check.
Hmm?
I can check.
You can check, okay. Sheikh Ahmed is planning to visit Malaysia for the honeymoon, huh? Yes. Bali, didn't it? Okay. We have headway 17 for the coiling and stenting. In combination with Xeon Blue, we have one of the last GK wires on the shelf, but I don't want to use it now. Maybe we'll need it for the other occasion. Huh? I think it is the same for the resource limited countries. When the patient is paying or the governmental system. And now I should choose which material for which patient. Okay. Pico. We don't need to go there. It's MCA. Upper branch. It goes without any problem. Lower branch. And aneurysm. Aneurysmanın размерını ölçüyor. Inside the aneurysm.
This Turkey shaker. İşte biz onları Agli gibi действительно Agli Послание из Тимбера.
5, 4, 3.5. It's approximately 4 millimeter. Okay, balloon I will put here to do last stress facilitation. Okay. 4-8, 4-10 қандай спираль бар?
4-10 оптималда.
Microplex 4-12 бере салшы. Okay, let's work with the microplex. We will close the balloon to prevent the mistake. Okay, let's work with the microplex. Bir новый отделялка бере салшы. И 3-8, 3-6 не бар, соны бере салшы. Үште 6, үште 8 не бар? Үште 6 болса, үште 6 бере береміз. Үште 8 микроплекс. This is marker. I especially ask for the V-grip system because of the some issue with the detachment. 6. Yes, I think we will need a standard that. Не отделяй пока. Пока не отделяй. Не отделяй. Maybe we need a remodeling. We'll see. Smart mask. Okay. That branch now is better. Now we can detach. Еще раз больше. Больше. Okay, it's detached. Different voices. The previous system was very musical, and now it's just one beat, and it's detached. Екі де 6 ашып бере беріңіз. The first coil was 4x12 Cosmos microplex, and the second is 3x8 Cosmos microplex. Okay, it's okay. It's detached. Екі де 6 тағы біреуін ашып бере салыңыз. Hadi. Кірмеді. Қайтамыз. Алдымен Джонсон.
Сол үшін жүгіру.
Сол өзің күштісіз дейді. Алдымен 3-8 бере салшы. We'll place one more. The first coil was 4-12, then 3/8. Все 4-6 береміз. We use 3/6, then 3/8, 2/6. Now I'm asking for 3/6. And then we have on the table 2/6.
Қазір рауан пациент кетіп барады екен ғой, 1-2 сағатта. Сжимаю вам весь жасайын.
Плюс 1 секунд. Бітірейік, сосын сөйлесеміз, хорошо? Интерес. One of the next patients is with the interesting anatomy. Patient came with the dysplastic ICA and it's continuing to the MCA dysplastic and there is a fetal type PCOM and the dysplastic segment of ICA is compressing the optic chiasm. That's why patient has optic symptoms from the compression, and as a first step we decided to place ST-MCA bypass to protect the MCA territory, and as a second step we should decide should we do something stenting or occlusion. I think it's part with diverticulum. It's okay. Тағы бір 2/6 бере салыңыз. That's a different musics, huh? Okay. Итирер. Все итирер. It's a human factor during the placement of the hub. You can just touch with the fingers and it might be a problem. Okay. It's occluding that part. That's good. It's coiling the neck part. It looks like there is enough place, huh? Okay, let's do control engine and then we can decide should we do anything else or it's enough. Yes, also we can do two-stage treatment because of the financial part of the treatment. The government covers only, not government, the insurance system covers only $12,000. 2/6. Yes, this candidate could be also be the candidate for clipping, huh? Yeah. It's quite effective treatment with the craniotomy, and placing the clip to the aneurysm neck. It might be option, and it might be an option. And Marat Sarshev is a big fan of clipping. He graduated Ermapo in Russia, and his teacher was one of his teachers was Rivaz Jinjihadze. He's a microsurgeon, well known in Russia, and they tried to clip everything. Okay, let's deflate the balloon, and maybe now we have a little bit space for the last coil. It should be this place for the last coil. Okay. Detached. Sir. Нет, timid. Now it's detached. The one of the loops is facing the lower branch. That's why we can decide which branch of the MCA we should stent. The upper one or the lower one. Or there is no need for stenting, huh? But it's look like we need to stent this lower branch. Надо? Не надо? And coil went to the lower branch. This looks like a web device, and it's possible to leave like this, but then it might be a little bit risky. Yes, first of all I will place the slump mask, the catheter. The aneurysm is partially filling. This is another branch, huh? Okay, let's go to the upper branch. Yes. Close to the lower branch. Okay, now we can go with the balloon to the lower branch and check the position of the last loop. Okay, let's check it. Yes, the last coil loop is under at the side of the wall, and now we can check it. If everything is okay, we can leave it like this. It's not causing any problem. Okay. Let's take it out. That might be the loop. Okay, something like this. It's not disturbing the flow. It's like a web device, and now we have dilemma. Should we continue and place the stand, or if it's possible to leave it like this? Shahmet, what is your opinion? What should we do? Do what you want to do. It might be ideal, the standing. Okay. Good. Okay, I think we can finish on this stage, and we can do the standing at the second time. I think it's better. Okay, I hope you will agree with me. There is no problem with the branches. The aneurysm is nicely coiled, and if it's needed, we can place stent in 6 months. From 3 to 6 months we can place the stent. Better to do it earlier if it's needed. Okay, let's do MR angiography in 3 months, and then we can decide. If there is a recanalization, then we will place a stent. If it will be stable, we will follow. Let's wait for the expert sitting. Роман қайда кетеді дедім? Стоматология? У него проблема с зубом. Проблема с зубами. Dear colleagues, CT is ready, the brain is clear, the aneurysm is coiled, everything is okay, and next case is ICA dysplastic aneurysm. We will do under general anesthesia. Okay, see you in next 30 minutes.